Hi, I'm Dr. Ken Brassington from Physio Logic, NYC. I'm one of the chiropractors on staff here. I'm here today to talk with you about intervertebral disc herniations, explain them a bit, talk about how we treat them here at Physio Logic, and just generally give a picture of what it means to have a disc herniation, what are you dealing with, how is it treated here, what's the time frame for most patients that they would go through treatment. When we talk about a disc herniation, we think about the spine. We have 24 typically individual vertebrae in the spine, and associated with each vertebra we need to have what's called an intervertebral disc, which is essentially soft tissue between each bone. And that's how our spine is extremely strong and stable, but also very mobile. When we think about vulnerability in the spine, the disc itself, because it's soft tissue and relatively mobile, it's a bit more vulnerable to injury. Typically, there are two ways a disc becomes injured. Classically, it would be an acute injury. A good example is a sports injury. Like in a contact sport, someone flexes, rotates, maybe gets tackled, maybe gets hit from the side, and that force goes right into the spine and literally tears the outer fibers of the disc. That allows the inner portion of the disc to literally herniate out. This day and age, most of the disc injuries we see are actually more cumulative, and so there's not one sudden injury, but there's typically a series of small consecutive wear and tear type injuries to the disc. A good example would be, let's say for instance, I work as a day trader or in finance, and I'm at my workstation 12-14 hours a day, and I'm sitting for most of my day. That sitting posture is the highest disc pressure position there is. The longer we sit, the more that disc pressure elevates, and that's literally creating an internal pressure that adds to wear and tear of the disc. That over time, with deconditioning of the core muscles, you start to have a vulnerable disc that's already stressed. Okay, and then over time, the theory is that gradually the outer fibers of the disc just weaken, they fray in a sense, and then something really simple like bending over to pick up a piece of paper or a pencil, tie your shoes, and suddenly you have severe pain going down the back of your leg. And that's not the initial injury, but it's when we become aware that we've injured a disc. It was something happening gradually. Treatment of a disc is fairly straightforward. Most cases in a disc herniation, it's not going to require surgery. Obviously, sometimes depending on the severity, it is a surgical case. The first thing we look at is we do an orthopedic neurological exam. We want to know is this a disc? If it is, how severe is it? We have medical staff right here in the office, so if it is something that we think is at the level of severity that you would need to see a medical practitioner, we have them right here to evaluate you. If it's not, and we've done some imaging and MRI, for instance, and we've confirmed there is a disc injury, I'd say roughly about 80% of the time we can treat that very conservatively, and that leads into the main techniques that we use here to treat disc herniations. Our main technique is called Flexion Distraction Decompression, and it's actually practiced by, I believe, roughly 80% of chiropractors have some training in flexion distraction decompression. The majority of chiropractors do use it for disc treatments. Here at Physio Logic, all of our chiropractors are trained and certified in flexion distraction decompression. Okay, so we're talking about flexion distraction decompression, and I've got a model of two vertebrae in the spine and intervertebral discs here. Just to illustrate and clarify, the main thing we're doing when we're treating you for your herniated disc is we want to affect what's called the intradiscal pressure. So just to simplify, if you look at our model, we have a model of two lumbar low back vertebrae. In between these two bony vertebrae, we have the intervertebral disc. The intervertebral disc is primarily, it's considered soft tissue. So it has a very high water content and collagen and elastin, and it's essentially connective tissue. Now, it gets injured in a couple of scenarios. So if you look here, we have two discs representing a herniation here on this side, where you can see that the internal portion of the disc, which is called the nucleus pulposus, has actually come through the outer portion of the disc, which is called the annulus fibrosus. So essentially imagine a very tough fibrous coating on the outside of the disc. When that coating gets injured from wear and tear and starts to fray and tear, the inner portion, the pulposus, literally can herniate or extrude outside of the disc. So you can see that right here. If you look at this disc, it's more of what we would call a disc bulge. So we have stress to the fibers of the disc without necessarily a tear. So the inner portion, the nucleus pulposus, is protruding, but it's not actually escaping outside through a tear of the disc. Both of these are concerning injuries. Typically, a herniation will herniate and then compress the spinal nerve root. So how does that happen? If you look at the spine model from the side, you can see this space, which is called the intervertebral foramen. Okay, the nerve root projects through that space. If you have this type of herniation, oftentimes the herniation literally projects right into the space where the nerve exits. That herniation presses on the nerve, and that's what causes typically pain down the leg we know of as sciatica. Now, just to segue to, okay, how do we treat that with flexion distraction decompression? The main thing that we're doing when we have a patient on the table is we're applying a very gentle force but with a lot of mechanical advantage. And if you can imagine me actually creating a slight amount of separation, that's lowering the pressure inside this disc. And they've researched and measured that while the patient is being treated, the doctor is applying the pressure, you can reduce the internal pressure of this disc by, it's about, I think, 192 millimeters, which, and that's very technical, but that's a significant decrease, and it's been clinically measured, so we know that it works in that sense. The other thing we're doing when we're treating your disc on this table is that we're actually increasing the space. Let's say you have the herniation, it's in the foramen, it's pressing on your nerve root. When we apply the decompression force, we can actually increase the space here by about 28%. That's also been researched and measured. So literally, we're opening up the space, creating more space for the nerve, taking pressure off. The other effect, getting into the anatomy of the spine a little bit, we have what are called the facet joints of the spine. They join the disc on either side. So people talk about realigning the spine. When we're applying the pressure, we're actually manipulating these joints. So if these joints have lost their innate motion, we're actually restoring that and, quote, realigning or manipulating the spine. The other effect that's a very positive effect, I talked about the outside of the disc becoming weakened. It's called the annulus fibrosus, starting to fray, and then the inner portion can herniate out. When we apply the decompression with the table, we're actually increasing the height of the disc, and we're reducing pressure on the fibers, those annular fibers. The reason that's significant is the annulus of the disc is what they call, it's very highly innervated. So in other words, it has a huge proportion or high density of nerve endings. So in a sense, if it's injured, it hurts a lot more than anything else in the disc. So when we apply that decompression, we're literally reducing pressure on those nerve endings in the annulus, which gives patient pain relief. Well, I want to thank you for watching this video. My name's Dr. Ken Brassington. As I said, I'm one of the chiropractors on staff here at Physio Logic. I just want to reach out and say if you know or you suspect that you're suffering from a disc herniation, please come in, have one of the doctors here evaluate you, and determine if you are indeed suffering a disc herniation, any type of spinal injury. We get a great result with our patients using flexion distraction decompression, as we've talked about in detail here, and I really hope that you come in and I think we can help you. Thank you.